Good morning. Happy Monday, November 7th. So what's going on? Did you see Friday that the U.S. jobs report came out? 261,000 people were added, or jobs were added to the economy. Unemployment rate fell to 3.7%. Well, that's pretty good news. Also, the interest rates for 30-year mortgages dropped from above 7% down to 6.9%. So once again, that's good news here. And what else is going on? Hey, a little bit of trivial, interesting news is that there used to be an American explorer. His name is Bradford Washburn. And in 1937, he did an expedition and he lost his camera on a glacier. That camera was just found. That's kind of fun, an interesting little fact here. Now there's film in there and they're going to see if they can restore the film. I wonder if there's a selfie on there. Let's get to today's topic. So today's topic is going to be what I call the Medicare Supplement Advantage. Yeah, there we go. You're turning on your TVs, going onto YouTube, and whatever you do, you're seeing advertisements for the Medicare Advantage plans. But this is what I'm calling the Medicare Supplement Advantage. Gee, Mark, I really like the idea of a Medicare Supplement Advantage plan. So how do I get one? Wow, let me tell you how. If you're turning 65, you're in a guaranteed enrollment period. Bingo, boom shakalaka, fill out the paperwork, it goes through, it comes out. That's simple and easy. If you're working and you're coming off of an employer policy or you're obtaining Medicare Part B for the first time, you're in the same position. Guaranteed issue, boom shakalaka, covers pre-existing conditions. Unlike the Medicare Advantage plans and the prescription drug plans that have an open enrollment period for people who are already on these types of plans, and that open enrollment period we're in right now, October 15th to December 7th, a Medicare supplement plan can medically underwrite you. So if you're in questionable health, maybe you can't change your plan, or you can't go from a Medicare Advantage plan to it. The other thing is, what happens if you say, this is May, and you realize that I need to change my Medicare supplement from company X to company Y? You can do that at any time during the year. There is no annual open enrollment period. But once again, remember, hey, what do you mean by medically underwritten? Well, I mean they're going to ask you health questions. They can accept you, reject you, raise you up. Those are typically what I see. But really, Medicare supplements, there's a big advantage to it because it allows you to budget your cost a whole lot easier than with the Medicare Advantage plan. Is there a network? Well, no. Typically, if a provider takes Medicare, the provider is going to be in the network. You might find something that says Select, where there's a specific hospital network. So, you know, be careful with that. I've had people say, gee, I want the Select because Select's better. Well, not really. So be careful with that. You might find that there's two hospitals in a community and one hospital's not in the network, one hospital is. Or maybe you need to go out of state to like Johns Hopkins or to the Mayo Clinic and all. So you want to make sure that those supplement plans don't limit you like that. You could save a little bit of money, but in my cases, all those that have saved money when they really need to go to the hospital that they're excluded from will sit there and say, it wasn't worth the savings. So Mark, is a Medicare supplement right for me? It sounds like a great product. Well, I don't know. But if you give me a call, we can talk about your situation to find out what is in, once again, your best interest. So, hey, what's going on at the MLD agency? Well, you know what tomorrow is? Tomorrow is election day, which means we're going to be through with all these crazy, very offensive advertisements. This person is the reincarnation of the devil. That person's the reincarnation of the devil. You know what? They're all yahoos and clowns. And if we turn off our TV, turn off our YouTube videos and whatnot, when these things come on, maybe the advertisers will realize we're sick of this garbage and we won't be paying attention to it. You know what? Maybe if we as voters actually voted responsibly rather than as a popularity contest, we could actually get qualified politicians who know what they're doing rather than career politicians who just give us, headaches, raise our taxes, gives us lousy insurance policies and pat themselves on the back. By the way, they don't have what they require us to have. They have better than us, you know. So what's going on at the MLD agency? We did a number of Medicare supplements, drug cards, and dental plans last week. And we're also working with a client who's having trouble with being balanced bill. They went to their HMO for their colonoscopy. The HMO referred them to the HMO hospital, who referred them to an HMO doctor. That HMO doctor then used non-network anesthesiologist. And this is where the problem comes. This all should be covered at zero cost. However, the client is getting a $1,100 bill. It's called balance billing. It's wrong. The insurance company has paid exactly what they're supposed to pay, so the client has come to me, working with it. If this doesn't work out, I am going to publish, doctors, you're on notice, I'm going to publish your names, the doctor who referred, and the out-of-network doctors who are balance billing. They will be in an upcoming video if this doesn't work out, because you, my clients, need to be aware of the scam that these doctors pulled on my client. Anyway, until next week, we'll be free of advertisements from the politicians. Take care.